Hey everyone, and welcome to a deep dive into
Hello.
Clinical Pathology Labs.
Yeah,
If you're listening to this, you probably want to get up to speed on these labs,
for sure.
and we're going to be taking all our information from this article
Right.
on the Assay Genie website.
Oh,
It's
yeah.
called Clinical Pathology Labs List, Overview, Services, and Importance.
That's
And yeah, let's just jump right into it.
yeah. Let's get into it.
So first of all, like when people hear Clinical Pathology Labs,
Mm,
they probably think of like
blood tests.
blood tests.
Yeah.
But like, what is it actually?
Yeah. What is it?
Do you break it down for us a little bit?
Yeah. So, it's analyzing bodily fluids,
Okay.
like blood and urine,
Yeah.
to diagnose and monitor diseases,
Okay.
and also screen for potential problems
Oh, wow.
and guide treatment decisions.
That's amazing.
So those are like the four main functions:
Right.
diagnosis, monitoring, screening,
Yeah.
and therapeutic guidance.
That's I had no idea that it could guide like treatment decisions.
like which that's so cool.
Absolutely.
So how does that work?
Yeah. So for example, let's say somebody comes in with a really bad infection.
Mm-hmm.
A lab culture
Oh, right.
can identify what bacteria is actually causing that problem.
Okay.
And then they can test different antibiotics to see which one will be most effective.
Oh, wow. That's amazing.
Yeah.
So it's not even just like,
It takes out the guesswork.
yeah,
Yeah, it helps determine the right medication, the
Yeah.
right dosage. Yeah.
that's so cool.
Yeah. So that's what we call therapeutic guidance.
Oh, so that's
Yeah.
what that word means.
Yeah, exactly.
Okay, cool.
Yeah.
So, okay, so we have this
Yes.
huge range of tests.
Yeah, the range of tests.
This article like broke it down into a few different
Category.
categories, right?
Mhm.
And there's so many.
Yeah, there's so many, so we can like group them a little bit.
Yeah.
Like hematology.
Hematology.
Yeah.
Gee,
Clinical chemistry.
Okay.
Microbiology. Immunology.
Oh,
Urine and stool.
okay.
Molecular pathology.
Okay. That one sounds
Yeah.
pretty intense.
Yeah, they're all pretty cool.
Okay.
So we can pick one from each
Yeah.
and kind of go a little bit
Okay.
deeper into it.
Cool.
So first, like hematology.
Okay.
That's like the study of blood.
Okay.
And I'm sure you've probably heard of like a complete blood count.
Oh, yeah. CBC.
Or CBC, yeah.
I've definitely gotten that done before.
Yeah, it's like the classic blood test.
Yeah.
That gives you like a comprehensive overview
Oh, cool.
of your health.
So what does it measure?
It measures your red blood cell count, your white blood cell count,
Okay.
hemoglobin levels, platelets,
Okay.
and that helps diagnose anemia, infection,
Oh,
clotting problems, yeah, all sorts of things.
that's amazing.
Yeah.
And I saw that the article mentioned bone marrow biopsy. That
Yeah.
sounds a little scary.
Yeah, a little bit more intense.
Yeah. Than just like a regular blood draw.
Yeah, so like when would you need to do that?
Yeah. So, it's more specialized.
Okay.
But it helps diagnose certain blood disorders.
Okay.
Like,
What?
leukemia or anemia. That's like
Okay.
not fully understood just from a CBC.
Okay.
So it's looking at like the factory where blood cells are made, which is your bone marrow.
Interesting.
Yeah. And they're examining it under a microscope
Okay.
to look for abnormalities.
So it's like looking at the like
Yeah, like comparing
it's
it very
blueprint versus like the final product.
Yeah, exactly.
Okay.
Yeah.
That's cool.
Yeah.
Okay, so switching gears a little bit.
Yeah.
I saw this term,
Mm-hmm.
molecular pathology.
Yeah.
And like
It's cool.
things like next generation sequencing.
Yeah.
What is all that about?
Yeah. So that's all about DNA and RNA, like the instruction manuals inside our cells,
Right.
and next generation sequencing.
Yeah.
Is this like super powerful magnifying glass
Oh, wow.
that lets us read those instructions like in such detail?
So that's like genetic testing.
Exactly.
Okay.
Yeah.
So what kind of information can we get from that?
Well, we can detect cancer,
Okay.
genetic disorders.
Okay.
We can see if somebody's more susceptible to certain types of cancer
Oh, wow.
based on their genes.
That's crazy.
Yeah.
Yeah.
And we can even figure out
Yeah.
the best treatment approach based on like the tumor's
Oh, wow.
genetic makeup.
Okay. So all this information.
It's pretty cool.
Yeah, that's super cool.
Yeah.
It's like science fiction.
Yeah, it is.
Okay, so
Yeah.
we have all these different tests,
Mm-hmm.
but like why are these labs like so vital to healthcare?
That's a great question.
Yeah.
Well, they're providing these crucial data points that inform like
Oh.
almost every aspect of patient care.
Okay, break it down for me.
Okay, so first, they're essential for diagnosis. We've talked about like identifying certain infections, pinpointing genetic mutations.
Yeah.
But it goes beyond that.
Okay.
Like routine blood tests might show elevated liver enzymes or high blood sugar.
Okay.
So that could be like a sign of liver disease or diabetes.
Oh, wow.
And early detection like that is really important.
Right. Yeah, it's always good to catch things early.
Yeah, exactly.
Oh, wow.
And then beyond just diagnosis,
Okay.
these labs are crucial for monitoring disease progression
Right.
and treatment effectiveness.
Okay.
So, for example, like somebody who's going through cancer treatment,
Right.
the labs can track their tumor markers over time
Okay.
to let the doctors know if the treatment is working.
Right, and if they need to change anything.
Yeah, adjust.
Okay.
Yeah.
So it's like
It's a feedback
a
loop.
feedback loop.
Yeah.
That's really cool.
Yeah.
Okay, so like what's the difference between that and like
Right.
just going to the doctor for like
Right. So the doctor might observe that a patient's symptoms are improving,
Okay.
but the lab tests will be able to confirm if the underlying condition
Okay.
is actually responding to the treatment.
I see.
Yeah. So it kind of takes out the guesswork.
Okay, cool.
Yeah.
So it's like objective evidence.
Exactly. It's objective evidence.
Okay.
Yeah.
So
yeah.
it's not just about like providing the information.
Right.
It's about like
Interpreting it,
interpreting it correctly
communicating it
Yeah.
effectively.
to like the healthcare providers.
Yeah. To all the healthcare providers.
So how does that work?
Yeah. So
Like how do they get the information to the right people?
it's a team effort.
Okay.
So you have the lab technicians, the pathologists.
Yeah.
They analyze the results,
Mm-hmm.
but then they need to explain it
Right.
in a way that the doctors and nurses can understand.
Yeah.
Yeah. So
Is it like phone calls?
technology,
ceremonial.
yeah, technology has kind of changed it. A lot of labs have electronic systems
Oh wow.
that transmit the results directly to the healthcare providers.
That's really cool.
Yeah, and then sometimes they have flags
Oh wow.
for like abnormal or critical finding.
Oh, that's smart.
Yeah.
Yeah.
And then some labs even have like specialists
Yeah.
who can help interpret really complex results.
Oh wow.
And they can give guidance over the phone
Yeah.
or through secure messaging.
Oh, that's cool.
Yeah.
So it's super streamlined
yeah.
and like fast.
Yeah, it's fast and accurate,
Okay.
which can be really important in certain
yeah.
situations.
Yeah, for sure.
Yeah.
This
yeah.
is so cool.
It's pretty cool.
I had no idea that all this was
Yeah.
going on behind the scenes. It's
Yeah.
like they're like the unsung heroes
Hmm.
of healthcare.
Yeah.
But you know, with all this talk about
Yeah.
the high-tech tests,
Mhm.
sophisticated analysis,
Yeah.
I'm kind of curious about like the human side of things.
Oh, yeah. What do you mean?
What is it actually like
Yeah.
to work
Yeah, what's it like?
in one of these labs?
It's fast-paced.
Okay.
Um,
Yeah.
But it's also really rewarding.
Okay.
The people who work there are very skilled, meticulous.
Mhm.
They have a deep understanding of science,
Okay.
and they really want to make a difference.
Oh, that's great.
Yeah.
Yeah, that must be like a really
It is
good
good.
feeling.
It is a good feeling.
Yeah.
Yeah.
Okay, so
It's not just about the science.
Yeah.
It's about like the human connection.
right, because they're part of like
Yeah, they're part of a team
a bigger team.
with the doctors, nurses, other healthcare providers.
Right, so it's like they're all working together,
Exactly.
like a puzzle.
Yeah,
to-
a puzzle.
Yeah, to help the patient.
Yeah, they might not see the patients face to face.
Right.
But their work is essential.
Yeah,
Yeah,
that's really cool.
yeah.
Um,
It's really cool.
I'm like starting to see these labs in like
Yeah.
a totally new light.
Yeah. It's not just.
Not just sterile environments
Yeah.
filled with machines.
Yeah, exactly.
Like a bustling,
This hub of activity.
yeah,
Yeah.
with all these people that are just like
Passionate.
passionate
and
about,
Passionate about it.
yeah, making a difference.
Yeah,
That's awesome.
it is.
So I am kind of curious, like
Mm.
with all this talk about sophisticated technology,
Mm.
growing demand for lab testing,
Yeah.
like what does the future hold for clinical pathology?
That's a really exciting question.
Yeah.
We're on the cusp of some really groundbreaking advancements.
Okay, like what?
Well, one is personalized medicine,
Okay.
where treatments are tailored to a person's unique genetic makeup.
Oh, wow.
Yeah, that's cool.
So your doctor could use your genetic information
yeah,
to predict your risk of developing certain diseases.
identify the best medications for you.
Okay.
Even monitor your response to treatment in real time.
Oh, wow. That sounds like
Pretty cool.
super futuristic.
Yeah, it's like the future.
Is that even possible
Yeah,
with like the technology we have now?
it's already starting to happen.
Oh, wow.
Yeah.
Really?
We're seeing personalized medicine being used for cancer treatment
Okay.
and pharmacogenomics, which is looking at how your genes
Okay.
influence your response to drugs.
Oh, wow.
Yeah.
That's amazing.
Yeah. And as we understand genetics more,
Yeah.
the possibilities are endless.
Wow.
Yeah. It's really cool.
I'm like on the edge of my seat right now.
Yeah.
So what else is there?
What are
Like
you?
what other advancements?
So artificial intelligence.
Oh, AI.
AI, yeah.
Okay.
It's changing the landscape of a lot of things,
Yeah.
including clinical pathology.
Okay.
So these AI algorithms can analyze huge amounts of data,
Oh.
lab results, medical images, patient records to identify patterns and make predictions
Oh, wow.
that like humans might miss.
Oh, that's so cool.
Yeah.
So it's like a super smart
It's like
assistant.
super smart assistant.
Yeah.
Yeah.
That's awesome.
Yeah.
Okay, so will it replace
That's a good question.
lab technicians and pathologists?
It's not really about replacing. It's
Okay.
about like collaborating.
Okay.
AI is really good at processing lots of data
Yeah.
and spotting patterns,
Mm-hmm.
but it doesn't have like
Okay.
the judgment and critical thinking skills
Right,
of a human.
of a human.
Yeah.
Okay,
Yeah.
so it's like AI can do all the
The heavy lifting.
heavy lifting,
Yeah.
but the humans are still like
The humans are calling the shots.
long the shots.
Yeah.
Okay.
Yeah.
That makes sense.
Yeah.
Um,
And AI can help
yeah.
lab professionals focus on the more complex stuff,
Okay.
like interpreting unusual results,
Yeah.
developing new testing methods, and communicating with healthcare providers.
Right.
Yeah.
That makes sense.
Yeah.
Right.
And it's not just AI.
Yeah.
We also have advancements in miniaturization and automation.
Yep.
So that's making testing
Yeah.
faster, more efficient,
Okay.
and potentially even available at home.
Whoa, at-home lab tests?
Yeah.
That would be insane.
Yeah,
Like,
let's-
imagine being
yeah.
able to test, like,
Yeah.
your blood sugar, cholesterol,
Yeah.
or, like,
Infections, all from home.
oh, my gosh.
Yeah.
That's crazy.
That's pretty cool.
Okay.
Yeah.
I'm, like,
Yeah.
so excited about the future of this.
It's a really exciting time to be involved in this
Yeah.
field.
This deep dive has really
Yeah.
opened my eyes to clinical pathology.
Yeah, I'm glad to hear that.
Yeah.
Yeah.
It's clear that these labs are so much more than just, like,
Mm.
places that draw blood.
Yeah, they're like vital hubs.
Yeah.
Yeah.
They're drive
Diagnosis.
diagnosis, treatment decisions.
Yeah, and patient outcomes,
Yeah.
ultimately. Yeah.
Okay.
I'm glad you see that.
Yeah.
It's a field with a lot of passionate people
Mm-hmm.
working behind the scenes.
Yeah. But I am curious
Oh, yeah. What's that?
about one thing.
What's that?
With all this amazing technology available, are there certain areas within clinical pathology that you're particularly excited about?
Oh, yeah, for sure.
Like, where do you see the biggest potential for breakthroughs in the years to come?
Well, honestly, it's hard to choose just one area
Right.
because the whole field is just like buzzing with potential.
Yeah.
But if I had to pick, I'd say keep an eye on the intersection of clinical pathology and AI.
Oh, yeah. AI, we talked about that a little bit earlier.
Yeah.
But I'm still a little fuzzy on, like, what that might actually look like in practice.
Right.
Can you paint me a picture of how AI could transform these labs?
Okay, so imagine a world where AI algorithms can analyze lab results in real time, not just flagging abnormalities, but like predicting potential health risks
Okay.
before they even become apparent through like traditional testing.
Whoa. So we're talking about, like, AI that can actually predict the future of our health?
Kind of, yeah.
That sounds amazing and a little unsettling.
It's definitely a powerful concept,
Yeah.
and it comes with a lot of responsibility,
Right, of course.
but the potential benefits are huge.
Okay. Yeah.
Early detection and prevention are key to
Mhm.
tackling a lot of diseases,
Right.
and AI could give us a huge advantage.
Oh, wow. Okay.
Yeah.
I see the potential.
Yeah.
But what about the human element?
Right.
Will AI eventually replace lab technicians and pathologists?
I see it more as a collaboration
Okay.
than a replacement.
Okay.
AI is really good at processing tons of data,
Yeah?
spotting patterns,
Yeah, we talked about that.
but it doesn't have that nuanced judgment and
Right.
critical thinking skills
Right.
of a human expert.
So it's like having a super-powered assistant
Exactly.
that can handle all the, like,
All the heavy lifting.
the grunt work.
Yeah.
But the human is still the one
Yeah, they're calling the shots.
calling the shots.
Yeah,
Making the final decisions.
exactly.
Okay. So,
That makes sense.
yeah, AI can free up
Yeah,
lab professionals
to focus on the more
to focus on, like,
important stuff.
the complex stuff.
Right.
interpreting unusual results,
Right.
developing new testing methods,
Okay.
communicating with healthcare providers.
Right. So all the stuff that requires like a
And
human brain.
exactly, yeah.
Okay.
And that's just one example
Okay.
of how technology is transforming clinical pathology.
Okay, cool.
We're also seeing advancements in miniaturization and automation, which
Okay.
is making testing faster,
Yeah.
more efficient,
Mhm.
and potentially even available at home.
At-home lab tests,
Yeah,
that would be a game changer.
it would.
Imagine.
Yeah, imagine being able to monitor your blood sugar,
Yeah.
cholesterol levels.
Or even detect early signs of infection,
Yeah,
all from home.
that's crazy.
It's pretty wild.
Okay,
Yeah.
I'm so excited about the future of this field.
It's a really exciting time
Yeah.
to be a part of it.
Okay, so back to like the present.
Okay, yeah.
The article mentions choosing a reputable clinical pathology lab.
Right.
What should people keep in mind if they need to do that?
Yeah, so that's a great question.
Yeah.
And it can be overwhelming
Yeah.
with all the labs out there.
Yeah, pressure.
First and foremost,
Okay.
accreditation and certification
Okay.
are key.
Okay, so you want to make sure that the lab...
Yeah, you want to make sure it meets high quality standards
Oh, okay.
and follows strict protocols.
Yeah, so they're not like cutting corners.
Exactly.
Okay.
Yeah, you want accuracy and reliability.
Right.
You can look for accreditation
Right.
from organizations like the College of American Pathologists
Right.
or the Joint Commission.
Okay, cool.
Yeah.
Are there any other like red flags that people should look out for?
Well, beyond accreditation, it's
All
always
right.
a good idea to ask your doctor
Right.
for recommendations. They
Yeah.
often have relationships with labs that they trust.
Okay.
And they can kind of steer you in the right direction.
Yeah.
You can also check online reviews,
Right.
but take those with a grain of salt.
Yeah, because those could be biased.
Exactly. They can be biased.
So it's kind of like choosing a restaurant.
It's exactly like choosing a restaurant.
You want to ask friends
Yeah.
for recommendations.
Yeah. Ask your friends.
Read reviews.
the trusted sources.
Trusted sources.
Yeah.
Okay.
And just like restaurants,
Yeah.
you want to consider convenience,
Okay.
turnaround time, costs.
Right.
Some labs offer like online appointment scheduling,
Oh, that's nice.
home sample collection,
Oh, wow.
quick online access to results.
Okay, so it's like
Oh, it can be
getting more convenient.
more and more convenient.
Okay.
Yeah.
And of course, like insurance coverage.
Yeah.
It's always something to think about.
Always a factor.
Right.
Always check with your insurance provider
Mm-hmm.
to see which labs are in network
Okay.
and what your out-of-pocket costs might be.
Right. Nobody wants a
Nobody wants a surprise.
surprise bill.
Yeah.
Speaking of bills,
Oh, yeah.
like all this talk about high-tech tests, personalized medicine,
Mm-hmm.
is this stuff expensive?
That's a valid concern.
Yeah.
The cost can vary
Okay.
a lot
That's not,
depending on the complexity of the test,
okay.
the lab's pricing,
Mhm.
and your insurance.
Right.
Like,
So it's not a one-size-fits-all.
not one size fits all.
Okay.
Yeah. Some routine tests, like a CBD, are relatively inexpensive,
Okay.
especially if your insurance covers it.
Right.
But more specialized tests,
Okay.
like genetic testing
Hmm.
or next-generation sequencing, can be more costly.
Okay. That makes sense.
Right.
The more advanced.
They're more expensive. More expensive, yeah.
Okay.
But it's important to remember that these tests can give you really valuable information
Right.
that can help guide treatment decisions.
Mm-hmm.
So you could potentially save money in the long run
Okay.
by preventing like unnecessary procedures
Right.
or ineffective treatments.
So it's like an investment
It is an investment
in your health.
in your health, yeah.
Sometimes you got to spend money to save money.
Exactly. And
Yeah.
as technology gets better,
Yeah.
we can expect to see the costs go down.
Okay. That's good.
Yeah, and that'll make them more accessible.
Right. Because like
Do you agree?
healthcare should be accessible
It should be equitable. Yeah,
to everybody.
exactly.
And so that includes like these diagnostic tools.
Absolutely.
Okay, cool.
And that's one of the things that makes this field so exciting. You know,
Yeah.
we're constantly pushing the boundaries
Yeah.
of what's possible.
Of what's possible.
Yeah, not just with technology, but also making these advancements available to everyone.
Right. So it's kind of like democratizing healthcare,
Exactly.
using technology to level the playing field
Yeah,
so that everybody has the best chance at a healthy life.
that's the goal.
Yeah.
Yeah,
That's awesome.
yeah.
Okay. This deep dive has really opened my eyes
Uh-huh.
to the importance of clinical pathology.
Yeah.
It's clear that these labs are much more than just places where they draw blood and run tests.
Yeah, they're vital hubs
Yeah.
of information.
Yeah.
They're driving diagnosis, treatment decisions,
Mm.
ultimately patient outcomes. I'm
Yeah.
glad you're seeing that.
Yeah. It's a field full of
Yeah, it really is.
passionate individuals
Yeah.
dedicated to making a difference,
Dedicated, yeah.
even though they're working
Behind the scenes.
behind the scenes.
Yeah.
But there's still one thing that I'm curious about.
Oh, yeah. What's that?
So with all this talk about like the future of clinical pathology,
Yeah.
are there certain areas within this field that you're particularly excited about?
Oh.
Like, where do you see the biggest potential for breakthroughs?
That's a tough one.
Yeah.
Um, I'd say keep an eye on the intersection of clinical pathology and AI.
Oh, yeah, AI. We talked about that a little bit earlier.
Right.
But I'm still like a little fuzzy on how that could actually play out.
Yeah.
Can you paint me a picture?
Okay, so imagine AI algorithms analyzing lab results, like as they come in.
Okay.
Not just, flagging the obvious stuff,
Right.
but like predicting health risks
Okay.
before they even show up on regular tests.
Oh, wow. So like predicting the future of our health.
Kind of, yeah. It's using patterns and data to make predictions.
Okay.
Yeah.
That's both amazing and a little scary.
It is powerful. There's
Yeah.
definitely a lot of responsibility there.
Right.
But the potential for good is huge.
Okay. Yeah, I can see that.
Early detection is everything with so many diseases.
Right.
This could be a game changer.
Okay, so I'm seeing the potential.
Yeah.
But what about the people?
Mm-hmm.
Will AI replace lab techs and pathologists?
I don't think so.
Okay.
I see it as more of a team effort.
Okay.
AI is great at data crunching,
Right.
spotting those patterns,
Yeah.
but it doesn't have the human judgment,
Okay.
the critical thinking skills.
Yeah, to make sense of it all.
Right. A human expert brings that to the table.
So it's like AI is the assistant doing the grunt work,
Yeah, the heavy lifting.
but the humans are still in charge.
They're the ones making the decisions.
Okay, that makes me feel better.
Good.
So the AI can help free up
Exactly.
those lab professionals.
Yeah, they can focus on the trickier stuff.
Okay, like what kind of stuff?
Interpreting those weird results.
Okay.
Figuring out new testing methods.
Mm-hmm.
Communicating with the doctors to make sure the patient's getting the right care.
Right, so all the things that need like a human brain.
Exactly. You got it.
Okay, cool.
And that's just one example
Okay.
of how tech is changing things.
Okay, what else is there?
Well, we're also seeing those advancements in like making things smaller and
Yeah.
more automated.
Right.
So tests are faster, more efficient.
More convenient.
Exactly. And maybe even doable at home someday.
Whoa, at-home lab tests.
Yeah, think about it.
That would be incredible.
Checking your blood sugar,
Yeah.
cholesterol.
Infection even.
Yep, all from home.
Wow.
Pretty wild.
Okay, I am so excited about the future of this.
Me too. It's a great time to be in this field.
This whole deep dive has been amazing.
I'm glad you enjoyed it.
Yeah, I went from knowing almost nothing about this
Yeah.
to now like really seeing how important it is
Yeah, it's the backbone of medicine.
to healthcare and just so much potential.
Absolutely. And it's only getting more exciting.
And to our listeners out there,
Yeah.
we encourage you to learn more.
Keep exploring this stuff.
Who knows, maybe you'll even want to work in this field.
It's a great field to be in.
Well, thanks for joining us on this deep dive into clinical pathology labs.
Thanks for having me.
And until next time, keep those minds curious and stay well.